What is lymphoma transformation? Lymphoma transformation is an important process that occurs when a slow-growing, indolent lymphoma changes into a faster-growing, more aggressive lymphoma. Understanding this transformation is crucial because it significantly impacts how the lymphoma behaves and how it needs to be treated. Indolent lymphomas, like follicular lymphoma, typically grow slowly. Many patients may not need immediate treatment. However, in some cases, genetic changes in the lymphoma cells can cause them to mutate and start growing more rapidly. When this happens, the lymphoma transforms into a high-grade lymphoma, most commonly diffuse large B-cell lymphoma. This transformed lymphoma behaves more aggressively and often requires more intensive treatment. Transformation can occur at any time after the initial diagnosis of low-grade lymphoma. Sometimes, it is already present at diagnosis, with both low-grade and high-grade lymphoma cells found together. In other cases, transformation may happen months or even many years later. The risk of transformation is highest in certain types of indolent lymphoma, particularly follicular lymphoma. Research shows that about 2 to 3 out of every 100 patients experience transformation each year, and up to 1/3 may transform within 10 years. Pathologically, transformation is confirmed by changes seen under the microscope. Doctors look for an increase in large, fast-growing lymphoma cells that disrupt the normal lymph node structure. This histological change is considered the gold standard for diagnosing transformation. Clinically, patients with transformed lymphoma may experience more rapid disease progression and symptoms compared to their earlier indolent lymphoma phase. Because transformed lymphoma includes both indolent and aggressive cells, treatment plans are adapted to target the aggressive component with the goal of complete eradication. Untreated aggressive lymphoma can be life-threatening. A related example of transformation is Richter's syndrome. This occurs when chronic lymphocytic leukemia, another slow-growing lymphoid cancer, transforms into an aggressive lymphoma, usually diffuse large B-cell lymphoma. This transformation can happen suddenly and requires prompt and different treatment approaches. In summary, lymphoma transformation refers to the change from an indolent to an aggressive lymphoma type, most commonly involving follicular lymphoma transforming into diffuse large B-cell lymphoma. This transformation affects prognosis and treatment strategies and is closely monitored by healthcare providers during follow-up of indolent lymphoma patients. If you have concerns about lymphoma or its transformation, it is essential to consult with a healthcare professional for personalized advice and guidance.